I'm a Mohawk Indian from the Six Nations Confederacy, which is the Iroquois Confederacy, which is in southern Ontario. Yeah, this is the Center for Aboriginal or Indigenous Health Research.
是原住民公共卫生、低民族公共卫生的研究中心。
Yeah, and we also have a School of Public Health, which will have a focus on Indigenous studies. We have a National Health Research Funding Agency. We have 13 institutes, and one is dedicated to Aboriginal health research. This is for two reasons. One, Aboriginal people have poor health status in Canada. On an average, it doesn't mean they're all unhealthy. I consider myself healthy, Karen's healthy, but overall, poor health status. So when Europeans came to the Americas, moved Indigenous people into smaller communities, and there were lots of epidemics of health problems that killed many people. So over time, depending on where people lived, if it was in a highly populated area like my ancestors in Ontario, people weren't able to maintain a traditional lifestyle of hunting and fishing and gathering food. It was not possible as much as it was in the past. Canada is a big country. In other places, they still have access to traditional food, and the traditional lifestyle is still available, especially in remote parts of British Columbia. That includes traditional medicine, because much of traditional medicine involves ceremonies, but also collecting medicines that are available, and knowledge keepers who understand what the traditional medicines, how powerful they are and what they're for.
First of all, my mother is a traditional healer. She was born on the land. My grandparents raised her on the land. She learned how to hunt and make her own clothes from caribou skin, moose skin, and she was born as a healer. So I've just been raised with my mother who treats people using her hands and her spirituality. So my research is looking at traditional healing and Western healthcare, because in Canada the primary method of how you receive healthcare is a Western approach. And again, traditional healing practices have been suppressed, historically suppressed. So I'm interested in looking at how these two forms of different healthcares from different paradigms if they can come together to work together. And the setting of my research will be in my community of Yellowknife in the Northwest Territories. So I'll be interviewing traditional healers or knowledge holders of traditional healing practices, and then on the other side, interviewing healthcare policymakers to have these discussions.
The Association of Inuit Women mobilized to take over midwifery in Inuit communities, and in Canada it started from the women's organization to go back to traditional Inuit midwife for birth. Because Inuit communities are so far away, the policy of the federal government was to fly them away from their community 1,000 miles or more, give birth away from all their friends and family, and then come back. And they didn't like that. They didn't think it was necessary to leave. And the second is many communities are creating healing lodges. Some communities are creating healing lodges that are connected to the healthcare system. And in British Columbia, First Nations people, Indians and communities are taking over the delivery of the healthcare system. And we expect there will be more integration of traditional medicine with Western practice of medicine when the community takes over the system, which is actually happening in this province, and it's very unique in the world.
I work here at the university in the psychology department, and currently we are doing research on something called cultural continuity, and that relates to Aboriginal peoples and the suicide rates that take place in communities in British Columbia.
We looked at all the suicides that took place in British Columbia for 21 years, and we looked at which communities those suicides were happening. And then we calculated the rate of suicide for each First Nations community in British Columbia. There were over 200 communities. Just being Aboriginal or just being young puts you at risk of suicide. Then the suicide rate should be the same in all First Nations communities. The suicide rate is not the same in all communities. More than half of the communities have no suicide. A bunch of other communities, the suicide rate is below the provincial average. And then some communities have really high rates. So then the question is why? Why do all these communities have no suicides? And all these communities have really high suicide rates. So we started to look at features of those communities. What's different about communities that have no suicide and communities that have high suicide? What we found is that the communities with low and no suicides are the ones that have been able to have a sense of ownership of their own cultural past and have a way of getting control of their own future. So we found things like the more people in the community that can speak the traditional language, the lower the suicide rate. Communities where they build buildings to hold cultural events, suicide rates are lower. And communities where women make up the majority of the seats on the band council, suicide rates are low. And it's not just suicide. We're also looking at injury rates, we're looking at school dropout rates, and in those communities where they have a sense of control of their future and ownership of their past, injury rates and the school dropout rates are low. The kind of theory that we're working on is that if young people lose a sense of ownership of their own past and a commitment to their own future, the person they're becoming, then this risk of suicide goes up. So that's true for individual people. So what usually prevents people from killing themselves is that they have some investment in the person that they're becoming. So that's for individuals. And then for whole communities, communities can support young people by having a sense of ownership of their own past and a sense of investment in their own future. If you live in that kind of community, you're supported.
This is just a brochure, Global Health. It's Global Indigenous Health. And we're very interested in an international perspective because everything we talked about, it seems very similar. In global health in Canada is usually about addressing poverty, gender issues, but not really much of an Indigenous lens on global health. We need to think about the future, think about an Indigenous lens on a global health concern.
This is where we show the appreciation in their own dialogue. Yeah.